When it comes to dealing with life-threatening conditions, injuries and accidents in remote locations where access is difficult, speed is of the essence. There's a window of time when prompt treatment at the scene can make the difference between life and death. Getting access to remote or difficult locations can be hampered by traffic, vehicles on the hard shoulder of the motorway, or where no roads exist. Now, the answer to the problem is with a fully equipped hospital emergency medical service, complete with paramedic and doctor on board. This is one of the busiest air ambulances in the country. It's the Warwickshire and Northamptonshire Air Ambulance. Based at Coventry Airport, the WNAA was launched in 2003. It currently serves a population of 1.2 million. The crew attends 100 call-outs a month on average, or around 4 calls a day. The average response time is just 6 minutes. It's also available to help out in other neighbouring counties when the need arises. NHS locals spent a typical day with the crew on board the Augusta A109E power helicopter.
The aircraft will cruise at about 145 knots, maximum speed 168 knots, which computes about 200 miles an hour. The start is very, very quick, so we can theoretically, from getting in the aircraft to getting airborne, be airborne within a couple of minutes and on our way to scene. So, for instance, here to almost Peterborough is going to be just under 20 minutes, so it's a long old distance in a short period of time.
Well, we fly a HEMS unit here, so we're crewed with a doctor and a paramedic on the majority of days that we fly. Rather than a transport medium, we're actually delivering care to the scene of the patient and advanced care, bringing intensive care and emergency medicine and surgery to the patient where they crucially need it as quickly as possible. There's probably a handful of helicopters throughout the country that regularly fly with doctors and paramedics. By having a doctor on board, the doctor's making a diagnosis on scene and saying what the patient, not only what they need now, but what they need in 1 hour, 2 hours, 6 hours, and even tomorrow. And that's cutting time off the patient journey to definitive care. So if you've got somebody with a significant head injury that needs a neurosurgeon, our time difference between that person getting to a neurosurgeon and the conventional way can be up to 6 hours quicker by using the helicopter.
My role is really to be a partner to the doctor. We complement each other. He will obviously take the clinical lead, and if there is need for his advanced skills, then he will obviously take the lead and we back up, drawing up drugs, getting kit prepared. Our expertise is more in scene management, in dealing with difficult extrications out of RTAs, the more generalised kind of scene management and dealing with difficulties. What differentiates us from ground crews is the fact that we do act as a bit of a co-pilot, and a lot of our training is involved in parts of navigation, meteorology, aircraft systems, so we take part in some of the pilot's sort of role.
A call has come in for the helicopter to fly a short distance to a golf course. A golfer has been struck in the head with a golf ball. In minutes, the crew are over the area looking for clues as to the location of the injured person. As they land, they find that the casualty's been moved from the course to the clubhouse. The helicopter is there before any land crew arrives.
If I just say to you, when it hit me, I felt as if my head moved inside. You know what I mean?
I'm sure it
vibrated.
Yeah.
Absolutely, yeah.
She hasn't lost consciousness and there's no sign of a significant head injury, but she does have a small wound to her head that's bleeding, but even though pressure has been applied to it, it just needs a little stitch in. But rather than send it to hospital and take up the hospital time, we're going to do that on scene and get her on her way.
I'll stick up a spot of super glue on it and then that'll be fixed.
Oh, look at you now.
You're welcome.
It's back to base. It wasn't a major injury this time, but the often remote nature of golf courses means that rapid response by air does have an advantage over land transport.
It's the speed of the aircraft that is the primary advantage. Obviously, we don't get caught up in traffic jams. We can go cross-country. We can get to very remote areas very, very quickly. And it's those kind of things that make a difference.
And it's not long before the crew receive a call to attend a much more serious accident in an even more remote location, a farm. The call is outside the crew's normal operating area in Derbyshire. A contractor on a farm has cut through his boot with a chainsaw. The injury to his foot is nasty and causing him severe pain.
How much pain are you in at the moment?
Enough.
Enough.
A combination of oxygen and powerful pain-killing drugs help to stabilise him, whilst the crew clean and dress his wound in preparation for taking him to hospital in Derby.
Are you all right with flying?
Yeah.
Cool. Have you ever been in a helicopter before?
First time this year.
This year?
This year.
You ever been on an air ambulance before?
No.
Okay.
That's good.
I'm glad you didn't say first time this year. It'll be a bit uncomfortable. Get you a blanket to rest your head on.
Even though another paramedic is on the scene with a car, to get a fully equipped ambulance to move the injured man from the scene will eat up valuable time. Airlifting the casualty will speedily get him to a source of treatment to prevent further complications.
The air ambulance is entirely funded by charity donations. There's no lottery funding, there's no government funding. It costs £1.5 million a year to keep it in its present state, but we need to expand and we need to provide a 24-hour service where we're saving those lives that at the moment aren't being saved because the helicopter isn't flying overnight or late into the evening.
How vital is it? Maybe you should ask one or two of our patients who are what we would call unexpected survivors. Had we not been available, had they not had the intervention of the doctors and the rapid transport back to a major treatment centre, then they almost certainly wouldn't have survived. And on average, we make a difference, if not a life saved, we make a difference to a person's quality of life, rapidity of recovery every single week, if not every single day.